There are many measures people can take to minimize their risk of falling, such as removing what may cause them to trip.
Hosted by Dr. Huân Mỹ Khánh and featuring expert neurosurgeon Dr. Nguyễn Quỳnh Tài. Watch on to find out more about helping stop senior citizens from accidentally falling. Greetings, cherished friends, and our respectful welcome to Protecting Our Elders by Preventing Falls, Part 1 of 2. We have the honor to have our program presented by Dr. Huân Mỹ Khánh, who is a board-certified podiatric surgeon. Dr. Huân earned her Doctor of Podiatric Medicine degree from Barry University School of Podiatric Medicine in Miami Shores, Florida, USA. She has worked in private practice and at a VA, Veterans Administration, hospital and clinic for many years. Most recently, she was with the Foot Center of Northampton, Massachusetts, USA. At the Foot Center, she performed forefoot surgery and provided therapeutic, restorative, and preventive podiatric care. She also diagnosed foot ailments such as tumors, ulcers, fractures, skin or nail diseases, and congenital or acquired deformities utilizing diagnostic aids such as urinalysis, blood tests and X-ray, magnetic resonance imaging or MRI, and computed tomography, CT scan analysis. In 2010, Dr. Huân joined the Supreme Master Jinghai International Association's Haiti Medical Disaster Relief Team to aid victims of the January 2010 earthquake in Haiti.
Hello, benevolent viewers. My name is Dr. Huân Mỹ Khánh from Âu Lạc, also known as Vietnam. The generous and free-spirited Ao Laxis or Vietnamese people wish you serenity and tranquility wherever you reside. Through medical technology and public health advancements, the average life expectancy across our world has increased dramatically since the mid-1800s. According to the United Nations, globally, the population aged 60 or over is growing faster than all younger age groups. All societies need to give attentive care to the expanding elderly population. Healthcare providers and caregivers are currently looking for better ways to keep the aged healthy and protect them from injuries. Dr. Nguyễn Quỳnh Tài, a practicing neurosurgeon in the U.S., has been a professor at the University of Florida College of Medicine, Jacksonville's Department of Neurosurgery for 30 years, and is the former chief of the department. In 2018, he wrote an article titled Mild but Dangerous Head Injuries that appears in a magazine published by the Vietnamese Associations of Physicians, Dentists, and Pharmacists of Florida. In this article, he provides profound insights into why even a small impact to an aged person's head should be a cause for concern. Today, we have the pleasure to hear Dr. Tài speak about this important topic and fall prevention measures for seniors.
In the elderly population, problems with balance, leg weakness, poor vision due to advanced age, cataract, or macular degeneration, or side effect from medication, all those factors render them prone to falls and injuries when they walk in the dark and bang their heads against doors and walls. These mild head injuries may not cause them great concern and are oftentimes forgotten. However, in this elderly population, a mild head injury can cause a minute bleeding at the surface of the brain, which can sometimes later form a large collection of liquid blood called chronic subdural hematoma. When this collection of old blood gets to be large enough to irritate or cause pressure on the brain, it may cause brain dysfunction, and if left untreated, it can cause a permanent deficit or even death. Well, in case of mild head injuries in the elderly, The initial bleeding is caused by a tear in one of the very small veins that go from the surface of the brain to the inner layer of the dura. The dura is a thin sheet of tissue of less than 1 millimeter in thickness that covers the whole brain. It lies at the surface of the brain but is not attached to it. So there's a very thin space between the surface of the brain and the dura, and in that space are so-called bridging veins. For these bridging veins span the thin space between the brain and the dura. In elderly patients, the space between the dura and the surface of the brain is enlarged because of brain atrophy. Brains in aging shrinks. That is to say, they become smaller, and this natural phenomenon causes some stretching on the bridging veins. When the brain is shaken by a bang to the head, for example, one of these bridging veins may tear and bleed.
We'll take a brief recess for a good stretch. Upon our return, Dr. Thai will discuss fall prevention tips for seniors. Please stay tuned to Supreme Master Television. Welcome back to our program, Protecting Our Elders by Preventing Falls, Part 1 of 2 on Supreme Master Television. Dr. Nguyen Thai will now tell us how to reduce the risk of falls in those of advanced age.
There are many measures people can take to minimize the risk of falling, such as removing what may cause them to trip. They should not leave any rocks on the floor of the houses, especially where there are elderly people living in the house. They should not leave any objects on the floors, such as children's toys, vacuum cleaners, electrical cords. On the floors of the house should be built at the same level so that there's less risk of missing a step. And all the rooms should be well lit. At night, when old people wake up to go to the bathroom, for example, they should turn on the light and not depend on their familiarity with the room configuration to let them think that they can navigate in the dark. They should be reminded to be careful when entering into or when getting out of cars, not to hit their heads, because cars are made differently, special small cars having low roofs. When they have banged their heads against something, even if it's a very mild impact, they should let their families know so that their loved ones can watch for complications.
To best protect our beloved elders, it is vital to be aware of their health conditions and to help them be safer during daily activities. Here is a recap of Dr. Thai's valuable advice to safeguard our senior citizens from falls. 1. Remove trip-causing items in the home. 2. Keep rooms well lit. 3. Remind the need for care in entering and exiting the car. 4. Watch for complications if there has been an impact to the head. The caring Dr. Thai is also deeply concerned with community health issues and leads the Life Weekly show, Questions and Answers program for health for Aulaxis, also known as Vietnamese speakers in the U.S. who do not have access to a medical provider.
When I started to practice in neurosurgery in Jacksonville, there was only a few Vietnamese patients using the services of our hospital. With the arrival to our city of more families from Vietnam in the orderly departure program, there were not enough Vietnamese-speaking physicians to serve this Vietnamese community. A group of friends and colleagues of mine saw the possibility of providing free medical consultation to all the Vietnamese refugee communities in the world, and also to reach out to the people in Vietnam who could not afford or who were unable to get to a clinic or to a doctor's office. So in 2004, we started to use PanTalk, a chat room service that was very popular among our Vietnamese refugee population. Listeners tell us their specific medical problems and medical issues that they would like to better understand and cope with. The doctors and pharmacists or dentists can answer right away or may inquire for more information from them about their conditions, then offer an explanation or give them advice. I would like also to mention that besides our QA program on Pantok, we have established at the same time a webpage where people can post their questions and our panel of consultants post their answers. There are now tens of thousands of questions and answers posted on this website.
We thank Dr. Nguyen Nguyen Tai for sharing his knowledge regarding mild head injuries and tips to stop falls from occurring in the home. We also commend him for offering free online medical consultation services to Aulaxi speakers in the U.S. For more information on the Questions and Answers program for health, chương trình vấn đáp sống khỏe, please visit facebook.com/CTVDSONGKHOE15. Please join us next Monday, August 13, for the second and concluding episode of Protecting Our Elders by Preventing Falls, where Dr. Tai will cover typical medical conditions that cause falls and subdural hematoma treatment. Thank you, dazzling viewers, for your company today on our program. Up next is Develop Compassion and Love along with Spiritual Practice, Part 4 of 8 on Between Master and Disciples. May all of our adored seniors enjoy lives filled with health and happiness. For more details, please visit suprememastertv.com/HL.